Hello everybody, thank you for joining me today. My name is Tamara Petrosyan, and what I'm going to be talking about today is how to discuss the importance of comprehensive pediatric eye exams in your communities. So I've been doing this for several years now when I go out into the community to different schools, the PSA meetings, PTA meetings, different offices in speech, occupational physical therapy offices, pediatricians, just to discuss the importance of comprehensive eye exams with parents and other healthcare providers. So since it's back to school season, I've had several people ask me to share my presentations with them and then just give some advice on how to get started. So I figured I would just make that available to everyone. So what we're going to do today is I'm just going to present to you the presentation or one of the presentations that I give to the parent-student associations, and then you are welcome to use that presentation in full or in part, or just take some of the information and use that in your own communities to spread the word about the importance of comprehensive eye exams, especially in this back-to-school season. A lot of people ask me where to get started, and I think that doing some form of a back to school program in your office. I don't have an office. I'm in academia, so I haven't done this personally, but I know a lot of people that set up back to school weeks, days, or even months in their offices, and they promote the importance of comprehensive eye exams. They have sales on their pediatric glasses and things like that. So doing some kind of a program in the office for specifically back to school is a great way to just get started. And there are a lot of mom groups out there now on social media, on Facebook, on Twitter. There are stay-at-home mom groups, working mom groups. So there are a lot of local mom groups that you can disseminate this information to, and they're usually very willing to hear this information because for a lot of them, this is not information that they've heard before. Businesses in the area, so children's gyms, art studios, play centers, after school programs, things like that are also good places to put out flyers or little pamphlets or do mini series lectures or mini screenings in those areas. That's also a good area that you can get into. And then if you yourself are not trained in pediatrics or vision rehabilitation, that's fine. You could always get the patients in the office, do a comprehensive evaluation, and then if you feel like further evaluation is needed, like a vision therapy evaluation or a perceptual evaluation or treatment, then you can always refer to your colleagues. But you are able to get the patients in the door and at least get them started somewhere. Again, parent-student association, parent-teacher associations, those are wonderful places to disseminate this information. They will usually have meetings, quarterly meetings, and they'll usually have school events. So those are great places for you to get a foot in the door. You could do talks at meetings like this one that I'm going to present today. You could do mini screenings at different events that the school has. It's always great to go in and get to talk to the actual teachers because they're on the front lines and they actually see these children struggling through school. So educating the teachers about what kind of signs and symptoms would be appropriate to make sure that the child goes in and gets a comprehensive evaluation is great. And again, the teachers are usually very, very hungry for this information. And then if you're able to get in touch with the school nurse and talk to the school nurses about adding in a couple of tests here and there in their general health screening. So they have to do a health screening for every child every year. And if you're able to go in and talk to the school nurses about adding in a near vision test or a +2 hyperopia check when they do distance visual acuity, or just teach them how to do distance visual acuities properly so that the child isn't peeking behind the occluder. Have the child read the letters from left to right with one eye and from right to left with the other eye so that they don't memorize the letters and just read them back without being able to see the letters. So things like that. You could always collaborate with other providers in your area, maybe put together a back to school fair so you could talk to pediatric dentists, pediatricians, tutoring services, or after school clubs. Those are always good people to collaborate with. But your speech therapists, occupational physical therapists, tutoring centers, after school learning centers, those are going to be the people that you're going to be referring back and forth to a lot with children that have, learning related visual problems. And then if you do infant exams in your office, or if you're part of the infancy program, the OBGYN office is actually a wonderful place for you to go in and put up posters, put up flyers about the importance of infant eye exams. So the infancy program AOA recommends that a child has their first eye exam at 6 months of age. And this is a wonderful place for you to, again, spread out that information, because for the OBGYN, their patient is the parent. So you're not really stealing a patient away from the OBGYN when you talk to the parents about making sure that they bring their children in for their first eye exam. So what we're going to do now is we're just going to jump right into one of the lectures that I give for the PSA meetings that I go to. And I have 3 kids. I'm on the board of directors for the PSA for my kids' school. I'm very involved in the community of, mom groups and everything in Jersey City, in the community that I live in. So it's a little easier for me to make those connections and to have a foot in the door. But even if you're not a parent, or if you're a parent, consider getting involved. If you're not a parent, you can still contact the schools, get involved, or find someone that is a parent to introduce you. Okay, so what I usually start with is just talking about why it is that we want to do a comprehensive eye exam. What is it that we're worried about, or what we're looking for? So vision disorders are the 4th most common disability overall in the United States, and it's the most prevalent handicapping condition for children. In 2006, there was an analysis of over 1,000 infants done, and they were checking to see if these children, aged 0 to 12 months old, had any kind of visual risk factors. A visual risk factor is considered something in the eye or in the visual system that either requires careful follow-up or it requires treatment. So in these 1,000 infants, 17% of these children had a positive risk factor, so something that either needed to be followed carefully or something that required treatment. And if the child was premature, was a minority, or had a low family income, then that increased to 25%. The issue here is a lot of these risk factors don't have any signs, so the parents themselves, you the parents, are not able to actually see that there's something wrong with the child's eyes or with their visual system, or they have no symptoms, or if they do have symptoms, the children don't actually complain of anything because they don't know to complain. This is how they've been seeing, how they've been experiencing the visual world for their whole entire life, so they don't know that you're not supposed to see double after reading. You're not supposed to be getting a headache after you do your homework for 5-10 minutes. The words are not supposed to move when you're trying to read. They don't know that not everyone sees this way, so they just deal with it. For children aged 6 and below, it's estimated that 10% of these children, so 1 in 10 children, has a risk factor for an undiagnosed eye or vision problem. But given all of this information, studies are showing that only 13% of parents actually make sure that the child receives a comprehensive eye evaluation by an eye doctor. The issue here being is that if some of these conditions are left untreated, they're left unfound, then this can lead to difficulties in their development, in their education, and for some of these things, possibly permanent vision loss. So it's very, very important that parents start bringing their children in, not for vision screenings, but for an actual comprehensive eye exam by an eye doctor. In terms of academic learning, why is vision important? So 80% of our understanding of the world, of our learning, comes through our vision. If we think about what happens before 3rd grade. So before 3rd grade, our children are being taught how to read and how to write. They're being taught their alphabet, they're being taught their sight words, and how to get visual information from the text. At third grade and on, they're actually using the reading to learn. So they're getting homework to read a chapter in a textbook. They're getting homework to just read a book, or they have to read things off of the board. And then they're getting quizzed and tested on that information that they have read. So if they're having visual problems that are affecting their ability to read and to learn, that is going to affect their ability to perform in school. If we take a look at what a common vision screening does, so the vision screenings that are done at a pediatrician's office or the vision screenings that are done at the school nurse's office, these screenings will usually check what the child sees at distance, how well they see far away, which is great. That is very important. If a child can't see far away, we need to know that and we need to be able to address it. But all that is catching are children that have nearsightedness, children that have a very high amount of farsightedness, or children that have a very high amount of astigmatism. So everything else that we're going to discuss today, children are going to pass a vision screening, and that is a very big issue because those things are going to affect their academic ability very significantly. If we take a look at what's recommended by the American Optometric Association, they recommend that a child has a comprehensive ocular and visual evaluation by an eye doctor at the age of 6 months. 6 months old is when the child should be having their very first eye exam by an eye doctor. And then if everything is okay, then when they're 3 years old, before they start school, and then every 2 years after that, unless there's an issue that the doctor says needs to be followed more closely. The reason we say 6 months old is because at the age of 6 months, the child's visual system is either at or very close to where it's supposed to be for an adult. So first of all, we're trained to evaluate a child at 6 months old. We have equipment, we have special training to be able to check what their vision is, if they have a prescription, how the eyes are working together, what their focusing system is like, what their eye teaming and eye tracking system is like. We can do all of this without the child having to say a single word. And the sooner we find a problem, the easier it's going to be to treat the problem and the better results we're going to get from treatment. So we really should be seeing every single child at the age of 6 months for their very first comprehensive eye examination. And the AOA believes in this so fiercely that they have created the Infancy Program. So the Infancy Program was created over a decade ago, and it is a program where optometrists that are part of this program pledge to do a free, totally free of charge, comprehensive eye exam for a first-time exam for children that are between the age of 6 months to 12 months. So if you go to infancy.org and you put in your zip code, you can find a doctor in your area that participates in this program. Mention the Infancy Program when you call in to make your appointment, and the doctor will see the child and they'll do a full comprehensive evaluation free of charge. So what is it that we're looking for when a child is brought in, no matter if it's a 6-month-old or if it's a 12-year-old? What is it that we're actually looking for during the evaluation? We use high-yield tests to find high-risk and treatable conditions. And if there is something discovered, then depending on what it is, we might just leave it alone and watch it because sometimes things will get better on their own. We might say that we need to monitor it very closely, or we might need to treat. So it really depends on what the condition is. So what is it that we talk about when you talk about good vision? Is 20/20 vision enough? So when we talk about good vision, we have to be able to take good incoming visual information. We need to be able to process that information, and then we need to be able to obtain meaning from that information. So no, just having 20/20 vision at distance in each eye individually is not enough to say that someone has good vision. When we talk about having good incoming visual information, what does that include? What do we need to have for that? So first, we need to be sure that the vision is clear at distance. We're able to see at distance. That's where the 20/20 comes in. But we also need to be able to see clearly at near. So to be able to see clearly at near, we have to have a a good, healthy focusing system. So just like when you're using your phone and you're trying to take a picture and things are blurry on the screen and you have to push the screen to make sure that things get focused in so that things are clear, we have the same thing inside of our eye. We have a focusing system inside of our eye. So that focusing system needs to be working properly to focus things up close. Our eyes need to be working well together. So we need to be able to have our eyes pointing at the same place at the same time, no matter if we're looking far away or up close, so that we don't see double. And then we need to be able to have a healthy tracking system. So either being able to follow an object as it slowly moves from side to side or up or down, or being able to jump from one place to another accurately. So we need all of that to have good incoming visual information. What about if we just take a look at academics? So for fluent reading, to be able to read fluently, we need to